A very good afternoon and welcome to the topic Who needs IVF? A very important topic which everyone wants to know and want to have questions they want to talk about and they want to know. So we are glad to have our doctor Aradhya Achuri among us today to understand the topic and also the every detail which people want to know and they have doubts on. So the doctor will help you understand more in the session today. So stay tuned. And if you have any doubts, any queries, post that on the comment chat or comment section, or uh, just uh, just comment after the session whenever you interact with the session. And stay tuned till the last, as the doctor will be taking the questions in the last of the session. So be there. And doctor, now you have the stage.
Thank you for your warm introduction. Good afternoon, everybody. I'm Dr. Aradhya Achuri. I'm fertility consultant at Apollo Kondapur. Today, I'm going to be talking about who needs IVF. Do I need IVF is a question routinely asked by many couples who are unable to conceive. Many people think that if they don't conceive within few months of trying, they need IVF, but that's not true. IVF is not for everybody. IVF is not the first line of treatment for infertility. Today I will be talking about IVF and its indications. When is it actually needed? First, let's define infertility. If a woman whose age is less than 30 years has been trying regularly and having regular intercourse for over a year and have not yet conceived, and if a woman whose age is more than 35 and has not yet conceived after 6 months of regular intercourse, it is called primary infertility. If a couple has already had a pregnancy but are now facing difficulty in conceiving, it's called secondary infertility. The first step for any of these issues is doing tests for both the woman and the man to diagnose the issue. Before we give you any treatment, we need to first identify where the problem is. Then there are three tiers of treatment. The first one, where everything else is normal, you have just started trying, is ovulation induction and timed intercourse. In this, we will give you medicines, do a follicular study, see when you are about to ovulate, and ask you to have intercourse according to your day of ovulation. The next one is intrauterine insemination. This is almost similar to your timed intercourse, but in this, on the day of ovulation, instead of you having intercourse at home, the husband's sample is retrieved, washed, and the highly motile sperms are introduced into the uterine cavity of the woman. Then comes IVF. Today, we will be talking about IVF. IVF is a ray of hope for many couples struggling to conceive. IVF is done for patients with blocked tubes. As we all know, for a woman, the reproductive organs, the important ones to conceive, are the uterus, fallopian tube, and the ovary. In a month, you may ovulate from either of the ovary, the right or the left. Once you ovulate, the egg enters the fallopian tube and it waits in the tube for the sperm to come and meet it. When you have intercourse, the sperms which are deposited in the vagina swim up, enter the cervix, uterine cavity, fallopian tube, meet the egg, and if it's able to fertilize it, the embryo is formed. This embryo then travels back into the uterine cavity and implants. Only when all of this happens, pregnancy can happen. If there is no tube or if there is a block in the tube, the egg and sperm cannot meet. So, pregnancy cannot occur. For a pregnancy to occur, we need at least one tube which is functional. If both the tubes are absent or not functioning, it means if there is a block in both the tubes, you cannot conceive naturally. This is a condition where IVF is essential to conceive. Endometriosis. Endometriosis is a chronic inflammatory condition in which endometrium like tissue grows outside of the uterine cavity. It can affect the tubes, the uterus, ovaries, pelvis, and it can cause adhesions. If it's a mild to minimal case, there is chance of conceiving naturally or through IUI. In severe cases, usually mode of treatment is IVF. When there is low sperm count or low motility of sperms in the husband, as we have just spoken about, the sperms which are deposited in the vagina have to travel a long distance to meet the egg in the fallopian tube. So when the count is less or the motility is less, this cannot happen. In such cases, IVF helps. So how does it help? In IVF, the eggs are retrieved directly from the ovary, and the husband sample, which is collected on the day of egg pickup, the sperm is directly injected inside the egg. So even if you have 10 sperms, or you have only, if you have 1 million count with one with 10% motility also, it doesn't matter, because if the lady has 10 eggs, all we need are 10 good sperms. Because under the microscope, the embryologist looks at the sperms and select the ones which are looking good and are moving. This helps us in identifying live sperms. If a sperm is not moving, then they have to resort to other methods to make sure that it is a sperm which is alive, even if it is not moving. Even if it is not moving, many times by just injecting a live sperm, we have seen good embryos and pregnancies. So, what do we do if there are no sperms at all? In this case, it could be the sperms, if the sperms can be retrieved directly from the testes, we can still go ahead and do IVF. This is done by a procedure called as TISA, testicular extraction of sperms. So, usually, when there are no sperms in the semen sample, the next step is diagnosing why. Sometimes it could be just hormonal imbalance, sometimes it could be an obstructive problem. It means the sperms are being produced in the testes, but they're not able to travel outside. It could be because of a block in the tubes which carry the tubes, or the tubes which carry the sperms from the testes to the outside is absent. In such conditions, we can definitely retrieve sperms directly from the testes and use them for ICSIs. The success rate in these situations is almost equal to what we see in normal couples. For some people, because of hormonal imbalances or something inherited or which is seen through their from their childhood, if the testis size is small, sometimes we do help we can still get sperms from the testis. In this condition also, we can definitely go ahead and do IVF, and many times we do get good embryos and pregnancies in these conditions. Chronic infection in the semen. So, as we all know, testis produces sperms. But for the sperms to travel from the testis to the outside, there is a lot of fluid which is added. This could be from the seminal vesicles or from the prostate. This fluid acts as nutrition and a buffer medium for the sperms to travel from the testis to the outside. The infection could be in the seminal vesicles or prostate. So, giving multiple antibiotics multiple times can affect the spermatogenesis. It can reduce the count and motility. And many times, even after giving multiple antibiotics, this infection doesn't come down. In these patients, also going for an IVF procedure helps them in getting a good pregnancy rate. When there is high DFI in the husband, this could be again because of chronic infections. It could be because of conditions like varicocele, or their physical status, like they have the body weight is higher, they are overweight or obese. They have habits like smoking, drinking, alcohol, or substance abuse. In these conditions, also DFI can be high. In known cases of diabetes, we have seen many people who have high DFI. As age increases, also DFI can increase. Sometimes we never find out the cause why the DFI is high. But in these patients, going for ICSI gives their good pregnancy chance. Unexplained infertility. In unexplained infertility, we usually do not find a cause. Everything looks fine on the girl's side and also on the man's side. But multiple ovulation inductions have failed, multiple IUIs have failed. In these conditions, IVF can help us in diagnosing the issue as well as treating. Advanced age. As age increases, the number of eggs comes down as well as the quality. In this scenario, we cannot keep waiting and going through multiple cycles of ovulation, induction, and IUI, because the longer you wait, the number of eggs in the ovaries may come down. For women, women are born with certain number of eggs in the ovaries. As the age increases, the number of eggs come down. Once they cross 30, the decline starts. When they cross 35, the fall in the number of eggs is much more drastic. And when they cross 40, it is much lower. The number of eggs have come down a lot, and also the quality. In such cases, because we don't have much time, when the AMH is low and the age is high, IVF can give you a quicker chance at pregnancy. Low AMH or less number of eggs. When we know that the AMH, which is the ovarian reserve, is low, or they have less number of eggs in the ovaries. For some people, this can happen even at a younger age like 22, 23. For some people, this happens only after they cross 35. Irrespective of when it has occurred, when there is low AMH and less number of eggs, we need to plan pregnancy quickly, because the longer you wait and the AMH comes down, sometimes we may not be able to retrieve eggs in the IVF, or the retrieved eggs may not be of good quality. In such cases as well, when you have tried ovulation induction and IUI and they have both failed, IVF is the way to go. Fertility preservation in cancer patients. We do know that when cancer has been diagnosed, there may be surgery, chemotherapy, radiotherapy. Before they go for chemotherapy, radiotherapy, it is ideal to freeze eggs or sperms, because these may have an impact on the ovaries and testes. The drugs given to get rid of cancer can also cause damage to your eggs and sperms. If you're somebody who has not finished your pregnancy, finished your family, and are yet to get pregnant, it could be for both men and women. It is ideal to freeze eggs and sperm, so that when you are ready in your life to to have a baby, you already have some gametes frozen, which can be used later on, and ICSI can be done with your partner gamete, and embryo can be implanted. Always have a talk with your oncosurgeon before going forward with your chemotherapy or radiotherapy. Multiple IUI failure. Many times we see that once ovulation induction has failed, they go ahead and go for an IUI. If the HSG or your tube test, SSG, sonography, everything shows that the tubes are normal and still IUI fails, IVF can help you in getting pregnant. It also works as a diagnostic tool, because if everything else is normal but you are still failing to conceive, IVF can give us an idea of where the issue is. Is it with the egg quality, the sperm quality, the fertilization capacity of the sperm? Where exactly is the issue is can also be known by IVF. Ovulation disorders. Sometimes we see that some women do not respond to the oral agents or injectables we give to make an egg. Even if we give high doses of injections, they either do not make a single egg or may make multiple follicles grow. When we are going for IUI or ovulation induction, we ideally want only 2 to 3 follicles to grow. If there are 5 to 6 follicles growing and they do rupture, there is risk of multiple pregnancy. There is risk of ovarian hyperstimulation syndrome, where there is hormonal imbalance, which can affect the pregnancy and also the health of the woman. In such cases, going for an IVF will help us, giving you the better treatment, because in IVF, even if multiple follicles grow, there is not an issue. Actually, we would want multiple follicles to grow, so that your chances of pregnancy is high. The more number of oocytes we retrieve, better the number of embryos, and the more number of embryos you have, better is your chance of success. The If you have 10 follicles growing and you have 10 eggs, 8 eggs retrieved, 6 of them are mature. After being fertilized by sperm, if you have 4 embryos, we can transfer 2 and freeze the remaining 2. In case you conceive in your first attempt, you can have the remaining 2 frozen embryos. You can use it for your second pregnancy. In case you don't conceive in your first attempt, the remaining two embryos can still be transferred in your next cycle instead of repeating the whole procedure all over again. PGTA or PGD, where there is possibility of a genetically transmitted disease. This is usually advised when there is family history of certain diseases like thalassemia, sickle cell anemia, or there are known conditions like heart disease which is genetically transmitted, which you don't want it to be uh, transmitted to your kids. It can also be used for certain conditions like polycystic kidneys as well. And when you have recurrent pregnancy loss, PGTA can help you in understanding if the embryos are genetically normal or not. The same stands for recurrent pregnancy loss as well. IVF is just not a treatment but a diagnostic tool as well, especially for unexplained infertility. When we do IVF, many times it helps us in understanding where the issue lies. We have seen situations where, in spite of high dose injections, no more than 3 to 4 follicles grow. So, this helps us in understanding that the ovary is not responding normally. In these patients, we may have to give different kinds of injections and different kinds of trigger injections for them to make a normal egg. So if this was happening in an IUI cycle where they are making 3 to 4 follicles, this is a normal response and a good response. But for somebody with a good ovarian reserve, like a normal AMH and normal hormone levels, if only 3 to 4 follicles are growing, this is abnormal. This helps us in identifying the issue even at the level of stimulation. We have seen some cases where the follicles grow well, the hormone levels are good, but on the day of egg retrieval, we fail to get any eggs. This is called as a empty follicle syndrome. This also helps us to know that even though you have been, when you have been doing your follicular study, the follicle is growing, it is ovulating. If you have done your IUIs where the follicles are forming, they are ovulating, there was never an egg inside. In these patients also, changing the type of injections we are giving you, changing the trigger injection can help us in retrieving eggs. We had one case where the AMH was zero point 0.6, but she responded very well. During her stimulation, we could see 6 to 8 follicles growing well. On the day of trigger, we had 6 follicles more than 15 mm and 2 follicles more than 12 mm. Only after egg aspiration, we came to know that all of these eggs were abnormal. They were immature and arrested at GV stage. This is a genetic problem and which cannot be repaired even by changing injections or your triggers. These are abnormal eggs. They are not fit for ICSI. In such cases, they will have to go for a donor egg. Even though this could not have been diagnosed without going for an IVF, because during your follicular studies, the follicles look good, they are ovulating well, the endometrium is fine, hormones are fine, but the egg was abnormal. This can only be diagnosed after doing an IVF. Another finding we find many times is a thick zona pellucida. Zona pellucida is the outer covering of the egg. The sperm has to penetrate this layer and enter the egg. Only then the sperm can fertilize the egg. If the zona pellucida is too thick, the sperms can't penetrate the egg. So fertilization is not happening. You are ovulating well, the hormones are fine, the semen analysis is also fine, but you are not conceiving. Only after IVF, after the egg retrieval, we can see that the issue was because of the thick zona pellucida. You were not able to conceive naturally. In these patients, ICSI helps because in ICSI, intracytoplasmic sperm injection, we collect the sperm and we inject it directly inside the egg. So we are going inside the egg without taking the help of the sperm. This happens because in ICSI, we are using the needle to go inside the egg and inject the sperm. Many such patients with thick zona pellucida get good embryos after ICSI. Gradually, as the egg fertilizes and becomes an embryo, as the cells keep multiplying and the embryo increases in size, the zona also thins out. This embryo can hatch and implant after the embryo transfer. Hatching of embryo means the embryo comes out of the zona pellucida shell. Only then it can attach to the endometrium. If it cannot come outside of the zona pellucida, it cannot attach. It will undergo degeneration and pregnancy doesn't happen. So this hatching is extremely crucial. For few patients in eggs with thick zona pellucida, the zona continues to be thick. So even if the embryo is of a good quality, grade A embryo, but the zona is too thick and is not thinning out, it cannot implant. In such cases, laser hatching needs to be done. Before this is done before the embryo transfer. In laser hatching, we make 2 to 3 holes on the zona pellucida using a laser. This is done very extremely carefully so that we do not damage the embryo anywhere. This is all done under the microscope using a laser. So making such holes in the zona pellucida helps the embryo to hatch. It can then go on and implant. All of these conditions can only be diagnosed and treated following IVF or ICSI. IVF is a procedure where the egg is surrounded by 50,000 to 1 lakh sperms and fertilization is allowed to happen. In ICSI, directly we choose a sperm which is looking well, which is able to move properly and is injected directly inside the egg. That is the only difference between IVF and ICSI. It is done in the lab. And in the advantage with ICSI is that when we know that the issue is with the man, we are able to select a sperm which is looking better. In IVF, the fertilization happens on its own. So sometimes if the sperm quality is not good, after IVF, fertilization may not happen and you may not get any embryos. So we can see that IVF is just not a treatment, it is also a diagnostic tool. It is like any other test where the root cause of the problem is identified. This can help you in not only knowing where the issue lies, but also be able to treat it. It can help you even if your previous cycles have, even if this cycle didn't go well, it can help you in understanding what needs to be done better in your next cycle so that you can have a better chance at pregnancy. IVF success rate depends on your age, your MH, which is your ovarian reserve, and also, most importantly, the male partner. The semen quality also has to be good for you to get good embryos which can implant and give you a baby. Thank you. If you have any questions, we can take the questions now. Thank you for organizing this session. I hope this has helped you in understanding what is to be done with IVF and how it can help you. Thank you.